Today I'm going to talk to you about migraine. Migraine is a very special type of headache, typically involving one side of the head. And this headache is throbbing or pulsating in nature, and it lasts from 4 to 72 hours. It can be associated with nausea, vomiting, inability to tolerate light, and inability to tolerate sound in certain people. It can be triggered by normal activities such as walking and climbing stairs in susceptible people. Now, some people with migraine have an aura or a warning sign that the headache is coming. This aura can be flashing lights, zigzag lines in your field of vision, abnormal sensation in the face and hands, or weakness in the hand or the face. Not everybody has an aura. Some people have an aura. Now, what causes migraine? The exact cause of migraine is not known. In some, hormonal changes are the reason. Hence, migraine is much more common in females compared to males. In others, activation of cells deep in the brain, which are called the trigeminal-vascular system. Activation of these cells and the blood vessels causes migraine, but the exact cause is not known. Now, there are certain factors which can trigger migraine. It is important for you to identify whether you have these triggers. The triggers may be lack of sleep, stress, certain foodstuffs, loud noises, abnormal smell. Some of these may trigger migraine in susceptible people. It's important for you to identify if you have these triggers so that you can avoid the triggers. Now, why is it important to know migraine? It is a huge cause of disability. It's the number one cause of neurological disability worldwide. Underdiagnosis is very common, hence undertreatment is common, and we have good, effective treatment for migraine. There are variations to migraine as well, and these variations are something that you should note, as not everybody presents with the typical headache. Migraine can range from childhood to adolescence to young adulthood to midlife to elderly. In children, it can present with abdominal pain and vomiting, hence it gets misdiagnosed. In young adulthood, it can present 2 weeks before or during menstruation, so it's associated with the menstrual cycle. In midlife, the headache may be less prominent. What may be more prominent is the other symptoms such as blurred vision in one eye, abnormal sensation, or weakness. So migraine can be misdiagnosed as transient ischemic attack or a stroke-like symptom. Migraine can also present as dizziness in some people, and these people tend to go to the ENT because they think they have a ear problem, but in actual fact they have migraine. Migraine can also present for the very first time after a head trauma, and they attribute it to a symptom of the head trauma, but in actual fact they are having a migrainous attack. Some people have chronic migraine, that is, their migraine occurs very frequently. You are considered to have chronic migraine if you have migrainous features of headache for about 15 days in a month, or at least 15 days in a month. So it's important for you to identify if you have a migraine and not just brush it off as a simple headache. Thanks for watching. I hope you've enjoyed this video, and I'll see you next time.